acknowledge that well, first of all, members, local question 2 group, please just stand up. Be acknowledged. I want to acknowledge that both our paper and our recommendations range both upstream and downstream of immediate needs of children outside of family care. So for prevention, we didn't really stop just for immediate needs. It's hard to know where to start. I think in part that was due to the literature we were given to review, which wasn't necessarily limited. It was relevant to that issue, but we were a bit more expansive in terms of what we addressed than the title would suggest. On the recommendations, there are 15 of them. I will go through those. I'm going to paraphrase, but not read them all. Please read them in your paper, read them on the screen. We know that the wording can be improved, but please think about the substance and try to get at that. What did we miss in terms of what we've said? How might it be changed to be more effective? The research has tended to focus on certain issues, and I think leaving others relatively unexamined. So we found sort of some clusters of where research was available. We organized our recommendations into 3 groups on policy, practice, and research, although they didn't necessarily fit into those categories and some of them cut across. But that's the way they're laid out here. First recommendations, we need to focus policies. We need policies to focus attention on preventing separation and reuniting children. Secondly, we see need for policies that support shifting systems of alternative care away from institutional care towards family-based care. The evidence is, I think, very, very strong, particularly thanks to the Bucharest Early Intervention Project and others, that no child under 3 really should be in an institution on a long-term care basis. Evidence is much thinner when it comes to older children. There is some limited research. There are reasons that I think practitioners have a consensus around the fact that older children, adolescents, can do better in a family environment because a family is for a lifetime. It's not just a short-term issue. But frankly, most of the research that we found on institutional care really focused on very young children. So we see a real need for more research on the kids that are a bit older. Third recommendation under policies. We think that it's important to endorse, for the U.S. government to endorse and adhere to the UN guidelines for alternative care, the interagency guiding principles on unaccompanied and separated children, which got a very strong endorsement. There was a Delphi process that was carried out with practitioners. It was the single most used reference document amongst the practitioners identified. And then the UN Convention on the Rights of the Child. The U.S. government is not a signatory, but every country in which we're working, with the exception of Somalia, has ratified it. In South Sudan, good for them. So I think the reality is the environment in which we're working, that is the reference point on children's rights and being, and we need to be recognizing that formally in our program. And the 5th recommendation under policies, children's voices need to be considered in policy programming research. UNCRC certainly says that's a right of children to be heard. From a practical point of view, children's perspectives are very often different than those of adults. And it's simply not good practice to ignore their perspectives. Okay, the second category of recommendations relate to practice. First, and summarize this thing, assessment in early responses must give attention to preventing separation. Second, we need ethical systems for rapid identification and documentation of separated children and of child protection issues. We can learn from other sectors, such as, say, health and nutrition, where they have more developed surveillance systems, and perhaps we can adapt some of those methodologies. Third recommendation related to practice. Assessment should be both immediate and longer term, and it should be holistic. It should be addressing this whole range of issues: tracing and family reunification, food and nutrition, health, psychosocial issues, education, and livelihood. Sorry, that was there. Fourth recommendation under practice, linkages are necessary between immediate and longer term assistance. Fifth, we need to strengthen the social welfare workforce and community level child protection systems. And I'd say that this contrasts with probably what we've done more of, which is short-term, project-oriented, go in, provide this service, limited period of time, funding ends, it's kind of fall apart. And this recommendation relates both to the formal social welfare workforce and what happens at community level more in keeping, say, with customary law. Now, customary law isn't necessarily always something those solutions aren't necessarily what we would want, but we need to recognize where that is being used and take that into account. Okay, and the last set of recommendations relate to research. We need studies on the causes of children's separation to help prevent both at the primary and secondary level. Prevention in primary would be a refugee movement during that process, trying to prevent the initial separation of children. Secondary separation is rather pernicious. Sometimes is a function of the relief and assistance systems provided. The availability of orphanages, setting or some sort of congregate care for children. We've certainly seen attracting children out of households. So both primary and secondary prevention. Second recommendation related to research, we need, and I'm a bit concerned about the wording here. The idea, I don't know if we necessarily, at least in some context, want to do longitudinal studies of children outside of family care. We need to look at the long-term consequences of the child being out of family care. But ethically, if children are on the street, we're just going to track them for 5 or 10 years. I'm not sure that isn't built with. But we need to consider what are the long-term consequences of being outside of family care, and the research on that. and then specifically related to the consequences of residential care for children who have grown up and those that have aged out of institutional care. What are the long-term consequences related to orphanages, children's institutions, children's homes, children's villages? We need to understand that better. The research, as I said earlier, really has focused on the negative effects on infants and young children. And there's just not nearly enough research related to the longer-term consequences. And that our last recommendation related to research, and I think this is an interesting one, it was mentioned earlier. We need to examine the reasons behind the proliferation of institutional care, at least in some regions, and its persistence in others, despite well-documented shortcomings and the lower cost of family-based interventions. Mary Dwight Chapin in this country did research. It was pretty impressive in the first decade of the 20th century. John Bowlby, Ainsworth, others. I mean, there's a whole body of research that has changed the practice in this country. But resources continue to flow from the United States and wealthier countries to support types of care that we in our own societies moved away from. Why is that? We need to understand that dynamic better.
Excuse me for almost overlooking those wonderful recommendations that were so thoughtfully done. Any reactions, response? Did they fit with your green cards? Go ahead.
I'm Terry Goff from Should Save, and I just want to make sure that I'm not missing something. We're talking about interventions, and institutionalized children are a part of this, but I didn't hear anything related to domestic adoption or guardianship or anything that would move children out of institutions and into local families in a traditional kind of way. And I just wondered, is that something, is that my bias, or did you discuss that and decide not to include it, or what's your thinking there?
Is there evidence around the use of those techniques for moving children out of institutional care?
I think certainly as practitioners, we consistently advocate that, but I don't think in terms of the research that we reviewed, there was much.
Well, I mean, and maybe that's something we need to look at, or it could be that the policies haven't emerged in that way. Go ahead.
I was just going to say that's a little bit of a topic tomorrow morning on the longer term systemic kinds of issues related to focal question 3.
Okay, so we will hear a little bit more about it.
Yeah, we did look into interim care for children, as I mentioned, and foster age also is a little bit.
Our charge actually was immediate care, and we, to some extent, respected that, but not entirely.
But as we said, we have to link also the short term and the long term for this group.
Yeah.
But you would, I would assume, argue that it is an immediate care need.
It absolutely.
Right, that's what I was going.
Yeah.
So this is an area we should come back to. It would be interesting to have conversations at the table about that and why there might be less evidence there. Other comments or questions?
And actually, sorry, there's one of the recommendations that said we need more research on the outcomes of for children of alternative care. So that also obviously will include adoption.
Okay, well, I know that the room is getting kind of dark, but let's see if we can spend 20 to 25 minutes on our tables talking about the recommendations and what recommendations you would make. Again, I want to underscore how important it is to see the papers as draft. Gillian keeps reminding me of that, and the recommendations as draft, and we really need your feedback to flush them out. So let's go into our small table discussions about the recommendations around immediate care needs. Thank you.